Hello and welcome to Aging Matters. This is a show that is provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet. I'm the Public Advocacy and Outreach Manager for the agency and the host for Aging Matters. I'm glad we have an excellent show today. It's going to be jam-packed, and our program topic is Medicare Changes for 2023. And that will include a little bit about open enrollment and some other related programs. Our special guest today is John Vogel. He is a Medicare Trained Specialist, and I call him volunteer extraordinaire. So thank you for being on the show, John. Glad to have you with us to talk about this important topic.
Thank you very much, Ann. It is always good to come back every year and be able to share all the updates that happen.
All righty, we're going to start right in since we do have a lot to discuss. So let's start in with, as we're going to be approaching 2023, and as people are going to be making potential changes now for that year, let's talk about some of the things that are happening in 2023 with Medicare and related issues, whether it's new things coming or changes in 2023. So I'm going to let you start on that, John.
Thank you very much, Ann. Well, for everybody, there is some real excitement going on this year. Social Security made the announcement. It is official. We are going to get an 8.7% increase in our Social Security benefits. It's the largest increase in 40 years. So clap, cheer, and everything else, because we are getting a raise more than 1%. It's 8.7% is the official one for 2023. So you can start to look in November or December to get our little notice of how much you actually get for you individually. If you can go online, you can get it already online, but look for that increase. Everything is direct deposited. So when you see your new direct deposit next year, there will be some extra money put into there. And there's a lot of other things that are happening and changing. And actually, I'm calling them good changes this year, because our Part B premium, which right now is sitting at $170.10, is going to go down. Yes, that's a new word for Medicare, is going to go down to $164.90. So we are getting an increase in our Social Security and a decrease in our premium for Part B. Also on the Part B for our deductible, it is going down from $233 down to $226. So your deductible on your Part B is also a positive for us this year, which makes it pretty darn amazing, because most years we look, and if we get it on one hand, they take it away on the other. And in this case, we are getting a really good increase and some real reductions and everything else. There are some changes to the Part A and Part B deductibles, especially if you're in the hospital, and some changes to the nursing home deductibles and what we have to pay for them. So the things are much more positive on the positive side than they have been for a couple of years that you and I have been doing this. So I'm very pleased to be able to announce that those are good things that are happening to all of us that are in the Medicare and Social Security system.
And John, I'm just going to ask real quick, clarify for us, the Part B premium that's going down a little bit is what is Part B in terms of coverage for us, in case we've forgotten that?
All right, a simple explanation on the Part A, that is when you're actually physically admitted into the hospital. It is not the emergency room. It's not transitional care. It is when you're actually physically admitted. Our Part B of Medicare is our doctors, our specialists, our x-rays, our lab work, and that does include the emergency room, and it does include transitional care. So somewhere along the line, Part B is the things that you and I, Ann, would actually use. We don't ever want to get admitted into the hospital, but our Part B and Part A and Part B, if you are in traditional Medicare, that is your primary coverage. Those are the people who pay the bill first. So somewhere along the line, our Part B is getting more positive for us. It covers the things that we really do need to get done,
that we tend to use more frequently. That's
yes.
Great. Thank you for the clarification. So where do we want to go from here? Do you want to have some more on some of those changes? or look at
I'll
open
tell you what,
enrollment?
one of the things that people always ask because they get a little confused on is when do we do this?
Okay,
And this has not changed since the beginning of when Medicare changed over to this system. Open enrollment started on Saturday, which was October the 15th, and it will go through December the 7th. And basically, from that standpoint, you can make your changes to what you would be looking at for your Medicare coverage. You don't change your Medicare Part A and B. That remains exactly the same. A lot of people ask me that, do I have to renew? Do I have to call somebody? No, your Medicare Part A and B, once you're enrolled in that and you receive your red, white, and blue Medicare card, and it indicates that you do have Medicare, you don't have to do that again. On our Medicare card, we don't have any indication to say about Part D, and Part D is our prescription coverage. So that is one of the areas that every year, annually, you really should take a serious look at what your prescription coverage is. It is separate from Medicare. Those are run by individual plans throughout. We just happen right now to have 26 plans that you can choose from, which seems like a very large number, but actually, and that's less. There's fewer plans for us to pick from. But if you don't check your plan because it's absolutely perfect, it's working, no problem whatsoever, I don't even have to look at it. That's just when you go in February to go get your medications and you discover, oh my gosh, what happened to my plan? So now is the time between October the 15th and December the 7th to take a look and see, okay, what are going to be my copays? What am I going to pay as a premium, a monthly premium to belong to whatever plan I want to belong to? Do I want to go into this particular pharmacy? Is it better than that pharmacy? There's all kinds of things in this time frame that we should really be taking a look at and saying, okay, if you went, God forbid, if you had to go onto a new medication and you found out that somewhere along the line, they use the word tiers. I just use brand names and generics. If you all of a sudden had to go onto an expensive medication and you looked at your plan right now and said, oh, that's not covered, I'm paying hundreds of dollars, we need to take a look and see maybe there is a plan out there that will cover medication that you weren't taking before. So there's lots and lots of good reasons to look. And the amazing thing is that I have people that tell me all the time, oh, I love my pharmacist, I love my pharmacy, but they have two categories. This year, they're calling it in-network or preferred. They used to call it non-preferred and preferred, which made more sense. But if you are in a preferred pharmacy, a CVS, a whatever pharmacy it is, if you are in that pharmacy and you're using that to get your prescriptions and it's preferred, you will get a better price. So if you go into something and if you look in doing this yourself and you see something called in-network pharmacy, well, right away you think, oh, well, they should be that should be the one that works. Well, it's not. You will pay a higher copay and a higher price for your drugs. So it's not just a simple matter of saying, well, I want to be in this particular plan because I know the name and my neighbors are in, no, my brother does really well, all that stuff. The idea behind this is for you as an individual, look at it, and not a married couple. She might not be taking the same medications as you. Maybe she only takes one medication. Maybe she takes a lot of medication. Somewhere along the line, this time frame, this is it on your prescription plan. You don't have an extended time to enroll. You don't have another time to pick. You have now from October 15th to December the 7th. So it's time to really take a look and say, okay, and you should really look with someone that has some kind of knowledge about this. We happen to have Berks Encore that has the contract for our Medicare enrollments, but somewhere along the line that if you can get them yourself to visualize, I need to look at my plan. I just can't keep going. I need to look at my plan. So your first thing that you're going to do is eliminate your Medicare card. I'm good. I don't have to then do anything. The second thing you want to look at is your prescription, your Part D, and make sure it's going to be your plan for the best reasons, whether it be a really good, and there are some, and this year, the number one premium, the lowest premium is $5.20 a month. So
Wow.
you're not looking at saying, oh, this is going to cost me $200. You're looking at saying, wait a minute, I can get, and it's a very good plan. It has a good formulary. And just for the sake of everybody, your formulary is the drugs that they actually cover. And pretty much all the plans cover almost all the same drugs all the way through. But you can get a plan for $5.20 a month. We can put in all of your prescriptions and see exactly what you're going to pay. There's a plan for $11.10 where all generic drugs, T1 drugs, are free.
Wow.
So if you go to the right pharmacy and you're paying $11 a month for your premium and you're getting your prescriptions for free, wow, why am I not doing that? I should do that. Well, you didn't look at your plan. Take a look at your prescription plan during this time frame. Because in all the years, and you won't believe it, this is my 27th year, 27
Wow.
years. I can tell you, there are really, really good reasons to look. Not only did we get our Social Security increase and our decreases, we also have some very, very good plans. The other part is, and I have never participated in this, and I'm seriously looking at it this year, is mail order. Some
Okay.
reason or another, there are plans that can save you, and I've saved a couple of people already doing enrollments, over $1,000 just by going to mail order instead of into the pharmacy. So somewhere you need to look and say, okay, what do I want to do? How do I want to do this? If you just guess at it, you might not guess right. Call Berks Encore.
So if I'm researching, my current Medicare Part D plan, and I'm considering looking at other options, what might be out there, still matching my formulary, looking at the premiums and so on, will my current plan in any way send me anything also, that there might be some additions or changes for me to consider while I'm during this open enrollment period?
Yeah. By federal law, Medicare has told all of the plans that they must send you the changes for 2023 by October 31st. So pretty much everybody I know now already has those changes.
Okay.
The only issue I have with that is that's really hard to read, because most people call me and go, now what are they actually saying?
Yeah.
The big number that they look at right away is there's always been a deductible of some nature with a Part D plans, with the prescription plans. Well, starting January 1st, it's $505. So it's a larger deductible. And when you look at this and you look at what they sent you and you go, well, I don't know how my deductible works. In many of the plans, T1 generics and preferred generics do not apply against that $505. Well, if you got your information, you'd be reading forever to find out if that's how it was. So
Okay.
you do, and when you get into tier 3 brand names and preferred brands and specialties and all that, then all of a sudden you're looking at, okay, I do have that $505 to pay. I will be responsible for that. But the information from the plan you're in right now, by federal law, by October 31st, you are supposed to have that. And of course, when you go online, right now, if you go on to Medicare.gov, the 2023 plans come up. You have to actually go to another place and click on 2022 plans, but the 2023 plans are the ones that Medicare.gov are showing you, and they will show you what the premium is, and they'll show you, the second thing they show you is that $505 deductible. So maybe it applies to you, maybe it doesn't. So you need to put your prescriptions in and say, okay, will it apply to me? How do I do that? That's all part of this is why we have this open enrollment period, and it's all part of that you got to do.
And will it also say on there about, you were mentioning about not going into the pharmacy, but doing mail order, will it also tell me that?
It
that
will,
they'll-
it will
they can
tell
do that?
you,
Okay.
yep, it will tell you specifically, and it tells you in a couple different ways, which is really interesting for people because it will tell you the price in the pharmacy, and right next to it, it will say mail order, and you can go down. Now, remember, mail order is a 90-day supply, and you're going into the pharmacy, you can get a 90-day supply, but on the Medicare site, it shows it as a 30-day supply. So you're looking at that and you're saying, wow, this is that what? I don't understand that. Because on the mail order, there's only 4 numbers. That's 12 months, there's 4 numbers. And on the monthly one, you have a monthly one, but it'll show you the difference. And at the bottom of the page, it does calculate out for you exactly the total that you'll pay at the pharmacy and the total you'll pay at mail order. So you don't have to physically do that. They did it for you.
Well, that's nice. That's great. And so one of the things that John has mentioned is I'm going to encourage folks that if they are, they're looking at these things and still have questions or feel like it is still too confusing with the information, please know that there's a program that John referenced called PA Medi, MEDI, and it is a health insurance counseling program, formerly known as a PRIZE Health Insurance Counseling. There are trained, certified individuals who, just like John, are available to do that counseling to help you out, to look at your, enter your the medications that you take, online, on the computer, and so that you can begin to look at making some of those comparisons and choices. They are not getting any kickbacks. They're not selling anything. So that's why it's a great way to go. If you can get an appointment with a PA Medi counselor, you would call Berks Encore. That number is 610-374-3195 and ask for a PA Medi counselor. So I just want to do that before we continue, John, to make sure that people got that. So let's go on with some other things. Oh, did you have more on the open enrollment?
Yes, the last thing on D is people still say to me about the infamous donut hole. We don't call it the donut hole anymore. We call it the coverage gap. I guess that sounds better. I'm not sure. But those numbers change every year. So when you go into the gap, when you can come out of the gap, when you can go into catastrophic coverage, you need to research them and see what's going to happen, especially if you are taking some expensive medications. Speaking of expensive medications, for those of you that use insulins, and you probably saw it in TV or heard it or read it somewhere that insulins are going to be starting January the 1st, they're going to be maxed out at $35 a month. So that would be your copay would be $35. The issue with that is not all insulins are in that program. You need to go into your particular plan that you're looking at, put in your regular drugs without the insulin, and it'll give you the price. Then you can go back in there and put in your particular insulin. I have a list from the federal government. It's about 70 or 71 insulins that are in the $35 program, but already since Saturday, I've had at least 4 people that their insulins were not in the $35. So even though the news and the way they kind of expressed it, it said all insulins were $35. Not all insulins are $35, but there is a great savings, $200, $400, $500 in insulin prices. The other side of that is for insulins that you take. If you are on a pump, an insulin pump, that program only starts on July 1st. So they threw a little confusion in there. So someone who's on a pump with the insulins, and those of you that are, you know what I'm talking about, your insulins will change on July 1st. So there is, and even though we had all the good news in the beginning, there is that real reason to not just presume that your program's the best one out there. There's reason for us to really take a look. The other thing that changed radically was the fact, and I was standing at a pharmacy. I was actually getting some COVID tests for free, because just as an advertisement, if you can get 8 free COVID tests every month with your Medicare Part B. So if you go to any pharmacy, you can get 8 free COVID tests. That will last till January the 1st. But the one that I was standing there with, the young lady was going to get her Shingrix, her shingle. Now, remember, that's a double shot. There's 2 shots, and they've been averaging somewhere between $200 and $400. Starting January the 1st, 2023, they are free. So I said to this young lady, what are you here for? And she said, I'm going to get my shingle shot. And I told her to go home. Come back January the 2nd, because it's going to save her $200 per shot. So that's another really good result of a lot of argument from a lot of people trying to get the shingle, I'll call them shots, under the Part B of Medicare. So that is a top-notch thing for anyone. So anyone that scheduled themselves for doing their shingle shot, their Shingrix, hold off till January. Now, the other side we need to go to real quick, Anna, is Medicare Advantage plans.
Yes.
Most of our Medicare Advantage plans do have prescription coverage with it. What is happening this year that you need to really check is, does your hospital still accept your particular Medicare Advantage plan? There are plans that are no longer here. You would have been notified by that already, but you need to take a look. In Berks County, we have 2 hospitals, West Reading and Bern Township. Somewhere along the line, you need to take a look at your Medicare Advantage plan and make sure that you're still getting accepted there. You need to take a look at where you get your lab work done and all those little things. There have been some increases. And when you go into the hospital, there is either a per day or per stay fee. You need to take a look at those and see. I mean, if you're going to be paying $235 per day for 5 days, that's a lot of money for you to come up with all of a sudden. So there's real reasons. Medicare Advantage plans work. There's nothing wrong with Medicare Advantage plans as long as you understand you will have co-pays. I know you see on TV, oh, I can go to my doctor for free. That's only your primary care doctor. Your specialist, you're going to be paying. If you're going to go to get some lab work or x-rays, you're going to be paying. But this is a real responsibility. I always tell people, it's your homework. It's what you need to do. If I could do every person in Berks County, that would be wonderful. I can't. You need to take a look at your Medicare Advantage plan. Read it. I know it's long and it seems confusing, but read it to say, all right, if something would happen, this is what's going to occur to me. I will have this and this and this. We will have out-of-pocket money. The standard out-of-pocket money for 2023 is $8,300. That's a big number. So understand, if you're going to create medical expenses, you're shaking hands with whatever Medicare Advantage plan you have. You're going to say, I will pay this number, and the standard is $8,300. I will share in my medical expenses up to $8,300. So there's real reason, Ann, to make sure that they are taking a look at their Medicare Advantage plans. Medicare supplemental insurance.
So let's just take a minute, John, and tell us, what does that mean?
Okay.
In other words, so now we have the Part A and the B. And we've got
Yeah, I know. When you're in a Medicare Advantage plan, you do not use your Medicare card. You get no benefits from your Medicare card. You are contracted with whoever the Medicare Advantage company is, Highmark, Capital Blue Cross, Aetna, whoever it is. You're contracted with them. You get an ID card with them, and they are paying your medical expenses. Medicare does not pay anything. When you're in a supplemental insurance, then you, excuse me, you actually use your Medicare card. That is your primary payer. People will pay the first part of the bill. Supplemental insurance, that is to pay the parts of what Medicare doesn't pay. And depending upon the plan that you're in, it can pay up to 100%. So there's all kinds of reasons to select a Medicare Advantage plan or take a serious look at Medicare supplemental insurance. When you're in a Medicare Advantage plan, as I said, most of them come with a prescription plan. The supplemental insurance, you must buy a Part D plan separately from that. My last little bit that I'd like to just share with you, I'm the poster boy for PACE and PaceNet. PaceNet for the first time in
Let me just tell us what PACE and PaceNet.
Oh, I'm
Yes.
terribly sorry. I see it. So
You've got us all thinking
it's all
now,
in there. It's all in there, but it has to come. PACE and PaceNet in the state of Pennsylvania is our prescription company. It's our we are, in addition to your Part D, you can subscribe to PACE and PaceNet. The
And
PaceNet
there's
numbers,
some qualifiers for PACE
if you
and
qualify,
PaceNet, right?
yes.
Okay.
And the income levels have gone up. And if you are a single person, you can qualify for the PaceNet program with an income of $33,500. So it's not like you're a poor person. You take a look, and if you're a married couple, it's $41,500. And I had a young lady about a half hour before the show here that I was helping, and she was taking a rather expensive medication for the first time. She's been on it for about 6 months, and she said, I don't know if I can stay on this medicine, because I just can't afford it. And I said, have you ever looked at the PACE and PaceNet program? And she said, oh, I think I make too much money. And we did her income levels for her, and she qualifies for the PaceNet under her being a single person, her income, she qualified for it, and it's going to make that medicine $15.
Wow.
So
Great.
she now don't tell
You are her new
but
best
she loves
friend.
me. She loves me now because guess what? She can go to the pharmacy and get her medicine for $15, which for a single person still living in their own home, as you well know, Ann, it's
Making ends
expensive.
meet.
It's expensive to do. So if you've never looked at the PACE and PaceNet program, you can call. It's a toll-free number. You can call them.
Okay.
You want the number? I can give them the number.
Yes, if you have
Yes,
it.
it's 1-800-225-7223. And there is a live person that answers. You don't have to push 1287. You will get a live person.
And can we go online as well to find that?
You can go online with that to do that also. It's not a problem. They will take your information for you. They can verify your income. So if you even have a question on it, they can verify your income. But if they're, and the estimated, since the change of the the incomes in the state of Pennsylvania, they were estimating about 100,000 extra people would qualify. So if you're thinking, oh, I don't qualify, I don't qualify.
Well, we
Do
can
it
look
anyway.
so we can look online for PACE and PaceNet. We can go to Medicare.gov for some other things, or I'm going to wrap it up with, or call the PA Medi Health Insurance Counselors through Berks Encore at 610-374-3195. Got to get going, but we've covered a lot of great information, and I want to thank you again, John, for being up to date and helping us all understand this a little bit better. And thanks to everybody for tuning in to Aging Matters.
Thank you, Ann.